So talking about proning, it's a big topic. It's a lot to cover. I can't just cover it in one video. But the indications, the contraindications, the breakdown, the pathophysiology. So someone with ARDS, acute respiratory distress syndrome, we prone them, put them on their bellies. Very good literature. There's a ton of literature about this topic. It's not just like something we picked out of the air to do. This has been in the works for 20 years. Proning patients almost certainly reduces their mortality. It helps people survive, and it helps their oxygenation. So it can kind of get you out of bind if someone's oxygenation is really low. You prone them, and the mortality and their oxygenation usually improve. It's indicated when your P to F ratio, your PaO2 to FiO2, is low despite maximum medical therapy, and if they have other evidence of ARDS as defined by the Berlin criteria. I can talk about that another time. So you prone patients usually like 12 to 16 hours a day, supine them, see how they go. And the protocols can vary widely. I mean, you can do this for 3 or 4 days, depending on how the patients are doing. And there's a lot of theories of why it works. One of the main reasons it probably works is when you have ARDS, there's something called the baby lung theory, where you have parts of your lungs that are not recruitable, meaning you give positive pressure ventilation and you can't open those air sacs, but other air sacs are opening, and they may be opening too much, and you may be getting what we call regional barotrauma, too much pressure to parts of the lungs that's causing damage. And so by proning them, you may recruit other lung that may not be recruitable, and that's probably why it reduces injury to the lungs. You also can get drainage of secretions for the lungs. You can have better VQ mismatching. That's another topic. Again, there's a lot of complex topics. It's hard to cover in just one video. Contraindications, I mean, there's not a lot. One of them would be like having a recent sternotomy, like an open heart surgery. You probably don't want to put pressure on that chest. That probably is not going to work out.